Now recognizes the chairwoman of the full committee, Ms. McMorris Rodgers. You're now recognized.
Thank you, Mr. Chairman. Before I begin, I need to respond to what the ranking member said in his opening statement. I'm extremely disappointed that he and others on this committee have decided to make this hearing political, about the former president, about scoring political points, not about serious reforms. If you want to look at bad decisions, the number one mistake was blindly following Dr. Fauci, who was so focused on COVID-19 that he refused to think about every other aspect of public health, to the detriment of our children, our economy, our country. We've already had CDC Director Walensky in front of this committee, even in the last 5 months. And then Ranking Member Pallone did in the last, we've had her more in front of the committee this Congress than in the last Congress, when the Democrats were setting the agenda and refusing to have her come up here and talk about monkeypox or COVID. We celebrate this committee. This is a serious committee that does the hard work necessary to legislate. And we've shown that by moving complicated legislation on privacy and reducing health care costs, when we come together, we can do the hard work necessary to legislate. Why should examining existing agencies be any different? CDC has never been authorized, never. And now CDC has broken the trust of the American people. To be an effective public health agency, the American people must be able to trust and understand what is coming out of CDC and why. Like the chairman said, I had numerous conversations with Dr. Walensky during COVID. And I was impressing upon her that at the local level, the school districts, my communities believe there should be a different approach to COVID, to the masks, to lockdowns of our schools, our kids being locked down in schools. And she said, oh, Cathy, these are guidelines. These are not mandates. These are guidelines. Well, at the local level, they were mandates. And she said they shouldn't even be at the state level. Washington State was locked down until the spring of 2021. Unlike CDC's closed door moving forward initiative, this hearing is the start of our effort to focus on public and a transparent process to understand what Congress should be doing to make needed reforms, because that's our role as the elected representatives of the people. That is our constitutional responsibility, and it includes authorizing the committee or the agency, giving direction and guardrails. I am not interested in blindly following CDC and saying that, yes, they need more money, they need more authority, and we're just going to say yes to that. The American people rely on us to know how to make decisions or to know how decisions are made. They're relying on us to know how decisions are made at the CDC, how the priorities are set. The American people are relying on us to ensure that it is a transparent process. And certainly before we give them more authority and money, we as the elected representatives of the people need to ensure that we're fulfilling that responsibility. So I hope that this committee and all the members of this committee that I greatly respect and admire will come together. Let's do our job. Let's improve CDC. And let's make sure that the tone is not one that is about scoring political points. Okay? Yes, and we do have a disagreement over the data and the amount of data that we should just be handing over to CDC. So under CDC, they're requesting right now sweeping legal authority to require state and local governments, as well as hospitals, pharmacies, doctor's office to report health information to them if requested. In my opinion, this is dramatically changing the current federal-state public health relationship. And I'm deeply troubled by CDC's inability to articulate any limitations on how they would or would not use this authority. We know that people were being tracked during COVID-19. We know that. And we're working on a privacy legislation right now because Because we believe that individuals, I think that there's a shared belief among Republicans and Democrats that individuals need to own their personal data, and we need to have privacy protections in place. There's a lot more to do on this issue. There's a lot more questions to ask of CDC. My plea to my colleagues on the other side of the aisle is let's do this together. We are the elected representatives of the people. I yield back.
Gentlelady.